It's exactly 12, and we're going to be joined by Dr. Rabia Moti-Ghoor. She qualified as a medical doctor at Wits, and after that, she started training in ophthalmology under the expert guidance of Prof. Trevor Carmichael in the Wits ophthalmology department. Uh, and of course, after her intensive training was completed, this equipped her to deal with the most obscure of ocular pathologies. After successfully completing her specialty degree, she became a fellow of the College of Surgeons of South Africa and a member of the Ophthalmological Society of South Africa. She also comes from a family of doctors, and I guess it was no guessing what field of study Rabia would follow, and thus here she is, a qualified medical doctor and an ophthalmologist. So we're going to talk to her about keratoconus, and gives me great pleasure to welcome her to the show this morning. Assalamu alaikum, welcome.
Assalamu alaikum, Jazakallah Auntie Julie, and thanks for having me on the show.
My pleasure entirely. You are the late Dr. Aziz Moti's daughter, are you not? Or have I got it all wrong?
No.
No, I've lost you there.
So not Aziz, Razak Moti's daughter.
Beg your pardon. Yes, you're right. Razak, that's right. Your brother's a doctor as well, is he not?
He is.
Yeah. Okay. So I do have.
Yeah.
I'm losing sound.
Oh,
Sorry,
okay.
Can you say that again?
I said I did host the Medical Matters show on Salam Media for about a year as well.
That's right. So lovely to have you back home again.
Yes.
Okay. Rabia, the reason we're talking to you this morning is we had a young 18-year-old last week talking about keratoconus. It's a condition she's suffering from. And she was pretty distraught, very upbeat, I must say, very positive, but distraught at the same time because she wants to go to university next year, but doesn't have the funds to obviously pay for her operation. She bandied about some amounts around. I think she suggested that it costs 25,000 rand to do one eye, and something in the region of 85,000 rand for both eyes. It didn't quite make sense to me, but I think she might have been a bit nervous and got her figures all wrong. Is this treatment or is this surgery? And we'll talk about signs, symptoms, and what it's all about in a little while. But is this type of surgery offered at state hospitals?
Yes, the answer is yes, it is offered at state hospitals. Corneal transplanting, we actually in South Africa only have 2 eye banks, which makes the wait list in state and in private. I mean, the eye banks supply corneas to private and public. So the wait list is quite long. A lot of our corneas now actually come from overseas. There are some companies that bring them in, which is why we can get them a lot sooner in private than in state. I'm not sure whether the state does give that service as well, where they import the corneas. I think they were doing it at one stage if the patient could pay for the corneas. But I'm just not sure about now. But they do corneal transplants in state, definitely. I must tell you that that is the end result of keratoconus. So it's not the only treatment, but it depends obviously on how far her condition has developed and at what age she was diagnosed and all of that. So that is not, it's the last thing that we do for very, very advanced cases.
In terms of keratoconus, she indicated that it is a very, very rare condition as far as eye health or optical health is concerned. Would you have been correct in saying that?
No, not very, very rare. it's, you know, I mean, it's not like cataract and definitely, but it's not, you know, we do see them in our practices. It has a predilection for Indians, you know,
Okay, let's just try and take a short break because you're breaking up. I don't know if you can hear me. Rabia, can you hear me?
yes, I
Okay,
can.
let's. Oh, wonderful. Okay, it seems that she can hear me. There seems to be a bit of a problem on her side. Okay, Rabia, welcome back. Um, in
I
terms
think,
of, we look at signs, symptoms, and all of that in a minute or two, but in terms of someone being waitlisted, and we know what the wait lists are like at state hospitals, would that then suggest that the condition worsens whilst she's on the wait list?
unfortunately, yes, it does. But like I was saying, it obviously depends upon, you know, her heart disease is, whether there's not something that can be done before actually going on to a corneal graft. But I can't make any, you know, comments about her condition.
So
Because
what
other
is
corneal
what
grafting is done
is
in state, but obviously
right? Okay, so what is keratoconus? And
sorry,
she's
I didn't hear that.
18. What is a keratoconus? And
Yeah,
she is 18 years old. Would
it's
that suggest that there's a genetic component, that she was probably born with it and it just started progressing as she was, as she was growing up?
yes. So keratoconus is a sort of does have a genetic component, and you are born with an inherent weakness in your cornea, so that the normal pressures in the eye lead your cornea to bow forward, sort of like a rugby ball, and instead of having a round shape as a normal eye would, you know, our corneas have a round shape like a soccer ball. So with keratoconus, you have more of an oval shape like a rugby ball with pressures, normal pressures in the eye, but the cornea is weakened in these individuals genetically or hereditary. So this is what happens. Usually manifests like in the late teens, early 20s, and the disease usually burns out in the 30s. But this is just generalized statements. We do get keratoconus in kids the age of 5, you know, we do pick it up. So this is just a very generalized broad statement in terms of the age. So
If
because the cornea is
di-
inherently weak, the first thing we do is actually,
if diagnosed early enough
sorry, could
and
you repeat that?
if diagnosed early enough and proper intervention is in place, does that mean that the patient would have a 20/20 vision for the rest of their lives, or are they still at risk?
No, so if any patient is at risk, so if it's diagnosed early on, then we can usually slow down progression of disease so that hopefully it
Ah,
doesn't get to the point where the patient needs a corneal. Usually, most of these patients require glasses, but see, or contact lenses and see very well with them. So if it's managed properly and if it's caught early, it usually, you know, with nowadays we can do certainly slow down progression.
how does it present? How does the person realize that something's not right here? Because you don't have a frame of reference really. I don't know how well you can see, how well, how good your eyesight is, or anybody else's for that matter. So I don't have a frame of reference. How will I know something's not right here?
Okay, so this is the reason why we have eye screening from like sort of all the kindergarten age in this country, so that if it usually starts from there. If something's wrong with the child's eyes, it's usually picked up, you know, 6, 7 years of age when they do the eye screening in school, or if it's picked up later on in life, I mean, like an 18-year-old, they would know, that they, or 15 or whatever it is, that their eyesight is changing, they can't see so well. So usually the first port of call is an optometrist. So optometrists may see that a patient's vision is fluctuating more often than usual, or they may notice that if they have the testing equipment, they may see the values are leaning towards the side of keratoconus. And whenever an optometrist picks up something abnormal, they should refer on to an ophthalmologist for further investigation. So it comes.
So what are the signs? Sorry.
At school, and then
I do apologize. We seem to have so much of interruption on.
Be changing and fluctuating vision.
Mm-hmm. Is that about it? Rabia, I'm so sorry that this is such an important interview, and
so it's
okay. So treatment is surgery.
Can I carry?
Yes, please carry on. Let's see how far we can get.
No, not. Okay, so just in terms of the signs, so the signs would be visual abnormality. Okay, so from the patient, they would have the symptom of visual abnormality. The doctor then obviously looks at the signs, and we have various readings, which I'm not going to go into, in various things that we can diagnose keratoconus with. So from the patient's side, it would be changes in vision that they would, needing glasses or whatever, and then the optometrist is the first port of call who would refer on if they suspect anything abnormal. When we go on to do all our investigations, there's various tests that we do, how far advanced the keratoconus is. So the first actually that we do is we advise hard contact lenses, depending on the patient's age, depending whether they can tolerate them, depending on whether they can be fit. A simple thing that keratoconus is associated with is rubbing, and that's actually very important because a lot of these patients have eye allergies that we need to actually stop them from rubbing at the eyes, because the rubbing actually weighs down the cornea and changes the shape. We find it in like majority of the patients that have keratoconus, and all these things will accelerate the disease itself. Then in terms of treatment, so these are just basic things, control the eye allergy, correct refraction with either hard lenses or glass on what we see at the time. And going from there, there's a treatment called cross-linking. Now, this is inherently what we do is we infuse a dye into the cornea and try and strengthen the cornea using ultraviolet. And it's something that we would do on the majority of keratoconus patients that we catch early. It works very well. We can repeat it about twice over a couple of years, and it does significantly slow down the progression of the disease. However, if you happen to be one of the unfortunate ones that the disease progresses, it can be quite debilitating, because you get to a point where the corneal shape changes so much you actually cannot fit a contact lens on it. The patient sometimes, if it's very untreated and was very severe, gets scarring of the corneas, in which case you would have to do a transplant. There's a couple of surgical options in between the cross-linking and the core grafts. Unfortunately, those are highly expensive and are not offered in state. That's to sort of correct the eyesight, using various tools in keratoconus, and to try and change the shape and more regularize the shape of the cornea. Just to know that keratoconus patients are not really eligible for laser surgery, eye surgery, because the one thing that we worry about with anybody that we do laser eye surgery on is inducing keratoconus in a patient who has the underlying disease. So that's our, in a nutshell, the basic option for patients with keratoconus. But the important thing is to catch it early.
So we don't
Okay,
get to the point where we need to do a corneal graft.
Rabia, I think we're going to leave it there. Unfortunately, the line's not very great, but I think we got the gist of what the condition's all about. Thank you so very much for being with us on air this morning. I do hope we can talk to you again sometime soon. Assalamu alaikum to you.
Thanks a lot for having me, Auntie Julie. Assalamu alaikum.
My pleasure. That was Dr. Rabia Moti-Ghoor. She's an ophthalmologist. She also presented a program here on Salam Media. It was the Medical Matters show, which went out in the evenings, but I think she's probably taken a bit of a break from there. Hopefully we can talk to her in the future about other eye conditions. It's 12:28, and when we get back, we're going to be talking about toolkit for public servants or toolkits for whistleblowers.